How do you keep healthy boundaries with your clients? So Morag, did you want to answer that question? How do you keep healthy boundaries?
For me, it's just respect. I find if I respect them, they're more likely to respect me. And to be honest, I don't really have a problem saying no, that I cannot do something, or that I'm sorry, but that's out of my scope of understanding, or that's beyond my abilities. And for me, humor works a lot too. I can usually use humor to, not saying that this is not a serious field, but we don't always have to be serious. So that works the most for me.
Marilyn,
I'd love to know what you guys do.
Well, see, I'm very, very fortunate that, like I said, I'm able to attend First Nations ceremonies, and and I've learned so much through them. But working in the capacity that I work with, and sometimes it can be a very, very dangerous situation where you're working with people who need to get their drug, and they've told me themselves, watch out. Just you need to create a safe place, but we also need to make rules and to protect ourselves, and we need to have this understanding that even though we may be at a place where we're healthy, where we have clear boundaries as to what's healthy and not healthy, but for a lot of people, especially those who have suffered through sexual abuse, there's that mixed. It causes a lot of confusion. So we need to have very clear boundaries, and we need to maintain them every day. We need to work with our hearts, but we also need to take care of ourselves first. We need to do everything that we do with respect as well. I don't know if I answered your question, but yeah.
I had a couple of questions here while we're waiting for a couple of further questions. Rachel, I had a question about outside of the boundaries of Saskatoon. How do you reach out to other parts of the province?
Well, our educator, we have an education and youth coordinator. She travels far and wide. Anyone that asks us to come in, we will do everything we can to get there across the province. There are other organizations that we partner with in Regina. There's an organization called Transask and University of Regina Pride Center, which also provide education. And now Moose Jaw has a Pride organization. So we try to pass off to people that are closer, but we are the largest center of our type in Saskatoon, or in the province, so we do the best we can to get there.
And I think we probably have some requests for your poster. How do they get your poster?
Wow, it's not ready for release yet. It will be available on our website, which is www.outsaskatoon.ca. You won't be able to download it because there'll be a whole safe space package, which includes lots of things such as point form list that you can go through that has questions about how you can determine if your space is safe. And so if you get X's on lots of questions, you know that you've got work to do. So that'll be released in the coming months. And then from there, you can get access to these kinds of visual signs through having diversity training in your office, reaching out to us. And as I said, we'll send Amanda out, we'll send me out. We'll come and provide you with the education that you feel that you need.
Okay. Great answer, thanks. Thanks for the resources as well, and the in-development resources. Both Morag and Marilyn, I have a question for you. Don't know if you answered it. How do you get your clients? Do clients get referred to you? Do they come to you on their own? Just how do you get your client base? Morag, maybe first, if you want.
Well, I get a lot of self-referrals. I'm very fortunate that the infectious disease clinic will, if they have a client that they feel can use my help, they will contact me. They'll tell the client about our organization, and then the infectious disease clinic will contact me and say, can you go visit this person? And I'm like, sure, when? I've had referrals from a couple from doctor's offices, from public health, from current clients will bring in their partners and say, you have to sign them up, they can use your help. And that makes me feel good, because it makes me feel like I'm actually doing something right. So I'm not sure how Marilyn gets hers.
All of the programs that we offer through the STC Health Center are walk-in. So we are open every day from 8 till 5 p.m. and on weekends our needle exchange is open from 12 till 5. Mainly the majority of our clients have been through word of mouth, but we also, I failed to mention that we also do street outreach. So we literally walk out in the community telling people about the programs that we offer, but we're also on a lookout for clients that maybe need to get blood work done, or maybe somebody needs to get tested for pregnancy, or maybe this person is, there are different scenarios. We will literally go out on the street looking for them. So a lot of word of mouth, and also through the presentations that we do, and we do a lot of networking as well.
This was a question that was asked earlier as well to the former group, but all three of you have a website, is that correct?
Mm-hmm.
Everybody has a website. So more information about location and access and hours, et cetera, can all be found on your website, is that correct? Okay. I think Marilyn would be best to answer this question. Someone asked, how can we as healthcare professionals address racism in the healthcare setting or break the stigmas towards clients? How can we advocate?
That question is always asked. And I'm really glad that it's being asked. And a lot of times people also want to connect their clientele to spiritual supports as well, right? And like I said, we tend to think that we don't have this responsibility over issues that are not affecting us personally. But it's about those conversations that are taking place within your own groups, within these settings where maybe perhaps there aren't any First Nations people behind closed doors, and maybe they're not outright conversations about race or discrimination, or maybe I'm sure a lot of people have talked about missing and murdered women or HIV and pregnancy, because these are issues that are really right in our face right now. We need to stop those conversations. Basically, we need to stand up and say, hey, we shouldn't be talking like this. We need to be more respectful. We need to be more understanding. We have to remember that if we are having negative feelings or negative thoughts, those aren't, they're not coming from the Creator. They're coming from something dark. And like I said, this world needs more light, more love. And so everything begins with the thoughts that we have, and we vocalize them. And what we say is very, very powerful. So we need to have more positive conversations around eliminating racism. And as First Nations people, we need to have more positive conversations around HIV. We need to start talking about it without pushing that fear and that stigma, because so many people are afraid to get tested. So,
yeah, I think that extends on Rachel's comment there too. This is a safe place. You know, we need to take that one step further, right? So, okay. The next question is an important one, and I think I need Mona and Nicole to stand and answer this question, because I don't want to. So the question is, I don't know, you can decide who wants to answer the question, but the question is, how will you counsel a pregnant mom whose viral load has become undetectable and wants to breastfeed her baby? Okay, that's a good question, and it's a little area where we kind of touched on, but I think we need to elaborate.
Right. I think I used to be like Marilyn. I would point my finger, oh, don't breastfeed or don't do this. And I don't do that anymore. So I spend a lot of time with the patient talking about, what does breastfeeding or not breastfeeding mean to you, and have a discussion about why they want to breastfeed, and then counsel about, the risks of transmission, what the options are for formula feeding. One of the things we didn't say is before is that there's actually increased risk of transmission for mixed feeding. So if a woman formula feeds and breastfeeds together, that causes increased risk of transmission compared to exclusive breastfeeding. So the recommendation in Canada is to exclusively formula feed. We have been talking a lot about this across Canada, and I would probably, if a woman really wanted to breastfeed, I might be one of the only doctors in Canada who would potentially advocate for her that it could be possible for her. There's protocols in the U.S. and in the U.K. of how to support a woman with HIV to breastfeed. I have yet to have a patient. I had a patient recently who said, she wanted to breastfeed, and I told her, okay, well, we could do it, but we're going to have to work with the system. We're going to have to talk to the, pediatric infectious diseases. I'm going to have to see you every 2 weeks. You have to take your antiretrovirals, do your viral load. Your, children's aid could get involved, so, we have to talk about it. And then she just said, oh, forget it. I'm not going to do it. So I think it could be possible, but it takes a lot of counseling and work. So I haven't yet had a patient choose to breastfeed.
I haven't had the experience either that happened here in Prince Albert, sorry. But same thing, I would say, I'd definitely be inquiring with the team and research and what's out there, and educating mom just around it. And
Yeah. That is something that came out of the meeting when Nicole from earlier this morning and I were in Toronto at a meeting, and it talked about, are we counseling our women well enough? And it goes back to your question where you were talking to your mom and educating them as to why, breastfeeding isn't recommended in the mom living with HIV. And, are we asking all those questions so that they will say, well, how can I deal with it then if I bottle feed? I'm going to be asked questions, and you help them to develop a plan. But are we asking those questions fully enough to and giving them enough advice? It's just, the point of taking the time and, having a really complete discussion with that mom when you broach that subject around breastfeeding versus bottle feeding. Yeah.
that's right. We didn't really touch base onto that much, but we have really good conversations in regards to how they're feeling about breastfeeding, not breastfeeding, and different suggestions about what they can say if family or anyone inquires about not breastfeeding.
And also teaching them how it's really easy to bond with the baby with bottle feeding. So teaching them about that. That one of the advantages of bottle feeding is you can give the baby to somebody else and they can bottle feed and also bond with the baby. And Katie actually has an excellent booklet on infant feeding that goes through all of those points.
Yeah. Thanks. There was a couple of comments. Someone had texted in, the Healthy Mother, Healthy Baby in Saskatoon Health Region also has nurses, outreach workers who provide support, education and advocacy, so that's another resource within the community of Saskatoon. I got a comment from the folks in Regina at the ID clinic there, and they just wanted to comment on how great all the speakers were today and say thanks for a great presentation. So let me see if I had a couple more questions here. Let me see what I can do. Oh, Morg, tell me a little bit about what's in your office. What have you got in your office, your vehicle office? What do you provide for your clients in your vehicle office?
I have a picnic basket in between my seats, and I try and fill it daily, if not weekly, with the odd sandwich or some nuts, a couple of coupons for Kentucky Fried or Burger King, because a lot of times when I'm taking my clients somewhere, they're usually a little hungry or they need something, so I can share with them. Coffee cards, just little things to make them feel a little more comfortable. I let my clients smoke in my vehicle. I don't smoke, but I remember the days when I did, and if I was edgy or agitated, being told I couldn't have a cigarette made me want one more, and I didn't want to talk to the person next to me. So I find if I have the odd cigarette in the vehicle and I can offer it to my client, they're more likely to relax and, you know, share with me what they need to share with me. Because I've learned it's not about, I might think I'm special, my mommy might think I'm special, but it is all about my client.
And on that, I think we'll have to end the day. I'm so sad. I think there's probably lots of questions out there, and you know, I look forward to the 2017 version of e-learning. I just wanted to remind everyone, I have a few reminders, so please fax or email in your sign-in sheets. That's really important. I need the folks that organized it, please need it. As well, you were sent out a link with an evaluation or survey. Please make sure you go to that link and fill out that survey. That's really important. It provides important information for how we did today and, you know, what we might be planning for in 2017. I also had been in contact with the Saskatchewan Registered Nurses Association around the, you know, today's event and educational credit. So if you are a registered nurse and with SRNA, please make sure you keep a copy of the agenda and potentially the poster, and then you can put that and use this as part of your goals for your ongoing competency in education. So that's a good way to add to your portfolio. If you have questions that we haven't answered today, or you think of those later, as I said earlier, the contact email is contact@hivplt.ca. So please feel free to email that site, and we'll get your questions answered as soon as we possibly can. So she talked about the evaluation forms and the link. So please make sure you take that few minutes to fill those out, and it will, you know, as it will affect further e-learning events. I want to take a couple minutes to thank the media production at the University of Saskatchewan and Saskatoon, who were so gracious to us, the cameramen and the other producers, etc. They help make us feel at ease. Many of us are novices to this. I've not done this role before. There's several presenters who have presented for the first time, and to do it at this type of event is even more daunting. So I just wanted to say thank you for all the support that you provided for us today to make it go as smoothly as it did, or I think it did anyway, and just, you know, thanks for your support and encouragement. For sure, they were encouraging us all along the way. A special thank you to the Ministry of Health for supporting this continuing education and development for nurses e-learning event. And a special thanks to those specifically, Lisa Lockie, Amanda Glambos, Sherry Kellington, Lisa Looning, and everyone on the committee who assisted in the planning of this e-learning event and session for all of us today. And you know, especially Amanda, who did all the legwork on contacting the speakers, who were superb, like above the top. I couldn't imagine how well it flowed and what a great job and great information, and the passion and the advocacy and the personal stories all made it even more special for, I think, everyone in the audience today. Most important thank you goes to you as participants who sent in the great questions and, you know, who participated with us today. Thanks for joining us, and we look forward to other ongoing events. There is a website. You can go to the CEDN website, which is at www.usask.ca/nursing/CEDN, and you can find more about upcoming e-learning events, workshops, and conferences. And I just visited that site myself, and all these years of nursing, more than I want to talk about, I didn't realize the great resources and the great upcoming events that there are listed on that site. So it's a wealth of information for nurses out there. I look forward to seeing you again soon, as I'm out and about in the community and out and about in Saskatchewan, and I hope to visit a few more rural sites this summer, see the connections I can make. And any final words from anybody on the panel? We've got a couple more minutes here. You want to say anything? No? Morg, I can't talk you into saying anything else?
Just thanks for inviting me.
Yeah.
And thanks to the production staff, they really made me feel comfortable.
Anybody in the audience have anything? They want to go up to the microphone. We got a couple more minutes. Might have another question. Anybody? Anyone? No? You're putting me on the spot. Come on. Somebody's got to have something. Should I put you on the spot, Tara? Think of something to ask. Oh, there we go. Okay, someone's got one last question.
All of a sudden, I felt pressured.
It was truly pressure. Yeah.
Birds out there fluttering along, and I heard Taz, Taz, and I thought, what do they want me to say? Anyways, I really appreciate Marilyn, you sharing from the heart. For our people, that speaks to the spirit, and we have that understanding of how much work has to be done in the communities, and how much work has to be done with the professionals who work with us. When my brother passed away in 1994 from AIDS-related complications, you know, it was really a new disease back then. And he was a person who had no problem speaking to universities, and he was quite often invited to speak to the University of Alberta students of different disciplines. And I'd accompany him as his, what they called in term, the caregiver. I said, I'm not a caregiver, I'm a sister who cares. And there's a difference in that. As Indigenous people, we are emotionally impacted by the loss, not only as intergenerational trauma survivors, but also in the fear of the genocide that continues of our people across the land through systemic racism and through discrimination. And how do we address that? It's by doing things like this and working collaboratively and showing people that we can communicate and dialogue with one another without calling each other names, putting each other down, and uplifting each other and supporting each other with our disciplines and bringing that knowledge together so that we all work and strive towards that increase of love, that circle of love that I spoke of in the opening prayer. And I thank you all for increasing my circle of love. And I thank you all for coming today and being part of this. And for those who are sitting watching the monitor out there, from my heart I give thanks, because to me this is Creator's work. All of you coming together is a prayer answered. Hi, hi.